We all know the main cause of cancer is always the immune system. The weaker the immune system, the stronger the cancer, and vice versa. The stronger the immune system is, the less chances for someone to develop cancer or for the cancer to reoccur after cancer treatment. We all could have cancer cells developing, a normal cell that started to multiply or started to function in an abnormal way, and that's the definition of cancer. But our immune system should be able to recognize these cells and deal with it right away, either by terminating it or having the ability to repair it and bring it back to normal cells. Once the immune system is not being able to do this, then the cancers develop. There are a lot of predisposing factors, of course, which plays the role of the type of the cancer and the location of the cancer. And that's why we always believe that the immune system is the key point in all cancer cells, all right, and in all cancer treatments. And here we use the immune cells, all right, the patient's own immune cells to tackle the cancer. And this is represented in different treatments, like talking about NK cells or dendritic cells or CIK, which stands for cytokinase-induced killer cells. So, and what is the difference between, let's say, when we talk about integrative immune therapy and the conventional immunotherapies? So, the conventional immunotherapy, these are pharmaceutical drugs that are made to block certain receptors in the cancer cells so that the immune system could tackle it and could recognize these cells again. But again, as any other drugs, it could have side effects. These side effects could be serious and could be, let's say, tolerable by the patients. But again, it is a chemical. Some patients, I have seen myself, that they had a serious side effect of these drugs. And if the immune system is still weak, then these treatments or these medicines might not have the great effect as it should be. So the immune system should be strong enough for these treatments to work properly. And what we use is mostly the patient's own cells. So we harvest blood from the patient. We send it to our cooperative labs where we extract the patient's own cells. When we talk about NK cells, we are harvesting a type of the lymphocytes, which are the NK cells. These NK cells are, from their name, natural killer. So that means they are killer cells. They kill cancers, they kill viruses. So we extract these cells, we multiply them, we introduce cancer's proteins to these cells so that they could be trained, all right, could be strong enough, and then it is infused back to the patient. It has no side effect because it's the patient's own cells. So that's what they are made for. When we talk about dendritic cells actually comes in the form of a vaccine. Dendritic cells, from the names of it, that means that they have dendritics, they're dendrites. Under the microscope, they look like an octopus. So it has arms, it has legs that hooks into the cancer cells, and they start to break it down to alert the lymphocytes or the killer cells to come and say, we have a cancer here, we should attack these cells. So dendritic cells work more as the inspectors. They go through it, they go searching through the whole body for cancer cells and start making them visualized by the killer cells to work on it. And it is done in the same way where the blood is being collected from the patient. It's being sent to the lab, and in the lab we extract these cells in the form of a vaccine, which could be given as a subcutaneous injection near the lymph nodes. Why near the lymph nodes? Because lymph nodes contains the lymphocytes, which are the killer cells. So we inject them in places which are close to these areas, close to the cancers, so it's easier for them to search, to tackle, and to alert the whole immune system to attack the cancer. None of these cell therapies has any side effects because it's always the patient's own immune cells. A possibility of having low-grade fever as an immune reaction, but that's all what should happen. One answer doesn't fit all. So in our treatments, we always choose what is best. We always choose if the patient is eligible for these treatments or not, and would they benefit from this immunotherapy cells, or is it too early or is it too late? So we try always to get what is the best from the immune system, what is the best from the immunotherapies, and what's the best from all the treatments together, so that we could have a greater outcome for all patients.